Let's talk about those numbers and specifically the book you've written, which is great, Heart Smarter for Women. It kills more women than men, right?
Well, we have turned the numbers around thanks to the research for the American Heart Association. Up until probably 2015, more women than men died from cardiovascular disease, heart disease. With all of the research, all of the awareness, the numbers for women have definitely decreased. But we have hit, especially post-COVID, and with COVID, we have hit a troubling statistic. The numbers for men and women dying from are both going up. Yes.
Let's talk about specific and race. It's different for white and black and Hispanic populations.
Yes.
Why are the numbers, I don't want to put you on the spot, but just what are the numbers?
So when you think of heart disease or all of cardiovascular disease, black women and men, highest burden of heart disease, especially in black women. Hispanic women are definitely second, lower for white women. And it has to do with the fact that risk factors for heart disease, high blood pressure, very, very prevalent in black women. Diabetes, sedentary lifestyle, and we also now know, thanks to the research from the American Heart Association, that pregnancy-related complications lead to heart disease later on. And when you look at in the United States, the complications from pregnancy for black women, much, much higher than for white women. Black women who have preeclampsia, eclampsia, hypertension with pregnancy, gestational diabetes, a few years later develop heart disease, and it is not diagnosed. So underdiagnosis leads to catastrophic effects.
You were sharing a very interesting fact for Hispanic women. Only 1 in 3 know that it's the #1 killer.
Yes.
So this gets to be an education thing too.
Yes.
People need to know, right?
So when people are empowered, when people have knowledge, they can take action, right? And it comes back to what my colleague, Dr. Stacey Rosen, and I always talk about: partnerships are powerful. Yeah. So we at Northwell Health, as well as with the American Heart Association, want women to know, through the Katz Institute for Women's Health, you can take simple steps to prevent heart disease.
And I found out on page 186 on your book this morning, which is what I like about the book, know the questions to ask your doctor.
Right.
Know your numbers.
Know your numbers.
And make sure your doctor knows your number.
And one key thing, I think we always think about food. Food is health.
Yeah.
And we know that sort of you are what you eat, right? So for black women, we know salt is a problem. Black women and men, salt is a problem. So definitely decreasing salt is important, and the Heart Association talks about it. And then the whole idea of food insecurity, which we are trying to tackle at Northwell Health by partnering with communities and teaching young people as well as older people how to eat, how to make heart healthy choices.
So again, it's so many facets, and in so many respects it's complicated, but there are simple things to do. And here it is, as we send it back to Cindy, just hands-only CPR. That's the signal. So let's save some lives. Back to you in the studio.
John, thank you very much.